What up, AJ?
What up, brother?
What's going on, man?
Not much, man. So it's been a long week, to be honest with you.
I know. I love the Doctok gear, man.
You like it?
Yeah, man. Trying to match you. Well, you have the long sleeve.
I try to represent. And I like the long sleeves because I could kind of lift it up if I need to, if it gets hot.
And the people that wanted it, you should have showed up to Dancing with the Doc. You would have gotten one. So,
I agree.
Well, actually, if you won the draw.
Yeah, I know.
What are we talking about today, bro?
We're talking about artificial intelligence.
Man, that's
AI.
like such a big topic right now. Everyone is talking about
it. It is
this.
huge. It is huge. And,
so we're going to talk about AI and what impact does AI have in medicine, right? Because to be honest with you, most doctors are saying it's going to take our job. I don't think it's going to take our job.
No, I don't think so either.
But they're saying like in the future, it'll take our job. But I think if anything, AI is going to help us, man.
I agree. I agree. Well, you know what the problem is that I always use the Tesla analogy where you know how Tesla has artificial intelligence, it has autopilot, right?
Yeah.
Algorithms and programs. It has autopilot, it drives by itself. But you still got to put your hands on a steering wheel.
Yeah,
so that's how doctors are. You know what I'm saying? So like, yeah, you'll have AI available to you, but you still need to drive it. You still need to program it. And you have to also take into consideration that AI is not just some computer randomly. You need so much data, tons and tons of data for it to really start doing what it's doing.
100%.
You know? And then there's
without
laws.
the data, it doesn't work well.
You got HIPAA laws, you got privacy laws, you got so many different things that people are not going to share their personal information and stuff on this, platform.
But how much easier would it be? And we were talking about this earlier, like for a neurologist, right? When they get to the hospital, if they have 30 EEGs, they do 30 EEGs. Really, typically, it's like 3 to 4 of them are abnormal. The rest of them are normal.
Yeah.
By the time they're done the EEGs and they have to go round, they're just tired, they're exhausted, they don't even feel like talking to the patient. But what if AI can eliminate the negatives and just give you the positives? And all you have to read in the morning are those 3 to 4 abnormals.
Exactly.
Okay, and then just get to work.
Think of the time, how much time you have left.
It's going to save us so much headache, even for us. Like, what's our biggest problems as doctor, right? Time. You walk into that room, you don't have that much time with the patient. So if I'm going to prescribe a medication, I have to go through, our patients have 15 to 20 medications.
Literally.
I have to go through every single medication before I prescribe that medication, make sure it doesn't have an interaction, and make sure it's not harmful for the patient. But if AI can just tell me, medication, boom, this is what you give.
Simple.
And at the end of the day, we're going to make the final decision.
Yeah, of course. And that's why you still got to drive.
100%. And even with robotic surgeries right now, there's a guy in a different state working on you, but the doctor's actually using the software to make it happen.
I just think that by the time that happens, it's going to be a while. People look, since this chat GPT, it is, but it's just there's going to be a lot of laws and regulations by the government. It will help a lot of countries who don't have access to doctors, right? But you had a point about the EEGs with the positive readings or the negative readings. What I like about that is think about a patient that comes in for a stroke. We need a stat CT scan. The problem here is you get to the CT scan, then you got to wait for the radiologist to read it, then you got to wait for the radiologist to create the report. Then by the time it gets back to the ER, sometimes it could be too late, right? Imagine if AI did that.
Save so many lives.
Boom. All the radiologist has to do is it gave him the result, and all the radiologist has to just skim over it, and it's done. Yeah. You see what I'm saying? You don't have to do anything.
And for radiologists also, instead of having to go back to every single image, like let's say you have a person has a lung nodule, right?
Yeah.
And you're measuring the size of it. And when the radiologist reads it, he has to go back to every single image and compare. What if AI just did the comparison?
Yeah, it grew 2 millimeters.
Grew 2 millimeters, and now you found another one, and this is, it just makes it so much easier for us doctors.
100%.
Because nowadays, we're using so many alternatives, hiring PAs, hiring nurse practitioners. I'm not saying it's bad, but we're hiring everybody we can because we don't have enough doctors, and we don't have enough help. And even in hospitals now, like it used to be one nurse to like 3 to 4 patients. Now it's like nine patients, and they can't keep up.
It is.
And number one thing that people complain about, and you know what I'm talking about, is the time that doctors spend with patients. They're just not spending enough time, and they don't see on our side why we're not spending enough time, how much it comes with it. Like before you go into the room, you got to go, like, let's say it's a hospital follow-up. You got to read the whole hospital records, go through all their records, look through all their medications, go through all of that, and then go in there and spend 10 minutes. How? This is where a mistake happens. I do feel like AI is going to eliminate a lot of the mistakes that doctors make.
Definitely. It definitely has a lot of benefits. But the question then comes to what are the disadvantages of having AI?
Of course.
Right? So, and that's the scary part.
Everyone doesn't want to be run by robots.
I personally don't trust a robot. I would rather trust a human. But there's one thing that AI can never take away from us, is the empathy and the sympathy that the human doctor gives the patient. You know, you could go into a computer and tell you what's going on with you.
What about radiologists, though? Do you think that they're going to be slowly?
I personally believe
radiologists, but
I personally believe radiologists, cardiologists, certain that read like echocardiograms, dermatologists, they will. It might hurt them a little bit more than your typical primary care or internal medicine doctor. I think it'll only benefit us. It might decrease the jobs for the radiologists or cardiologists who do echoes and stuff like that.
Might not need to refer. Send an echo. You get the results right away. Come to you. It reads it for you. Like, it's going to save a lot. For me, I'm excited about AI.
Yeah.
And this is kind of similar to the time when social media world, all of this came in our grandparents, our parents, like, man, it's too much. I can't keep up with it. It's changing the world. This moment in time, it's either you jump on board and understand AI and learn it, and
I agree.
Make it your friend versus your enemy, because you do not want that thing to be your enemy, because we do have to have control of it, though. Yeah. Because if we let the computer and AI do everything, then yes, then it is going to eliminate a lot of jobs. It is going to eliminate a lot of jobs.
But it's also going to cost billions of dollars to get these type of software.
Of course.
To be honest with
and
you.
It needs data. It needs,
it needs data. It needs, patient. You're going to need to get permission to use all this data. Now, okay, so if it's a certain hospital, maybe they could use their own data and create their own software, a certain office. But that hospital is not going to share its data with that private office or the other hospital. So that's not enough data.
Yeah.
So the question comes is, how are we going to get all this data?
The EMR systems, let's be honest, AJ, EMR systems are terrible.
Yeah,
they're like very slow, and like, how much better would it be if AI, like the EMR was like fully AI, and everything you had was there. Yeah. Like, even when you type the note, stating like write a letter for a patient to go back to work and no minimum this, and it writes a perfect letter for you, right? Obviously, there's going to be rules on it where, like, copyrights, people are like in college and stuff like that. It's going to be kind of dangerous. You know what I mean?
I agree. But I don't know, man. I just feel like there's going to be tons of errors. I feel like at a certain point when it starts, we're just going to be getting a lot of errors and a lot of mistakes. And maybe just a lot of it is just the beta testing, right? But do you personally trust the AI completely?
Not completely, but I feel like we're going to get there.
How would you use it in your office? How would you think AI will benefit in your office?
Okay.
Give me a scenario. I'm a patient that came in to see you.
Yes.
Boom.
Okay. First of all, like I said, with the medications, that's the first thing I would use, right? All the medications in AI, and then for example, a culture. Yeah. Culture's in the system, gives you resistance, sensitivity, right? Then that goes into the medication list, tells you which medication, like if, there's a interaction between what medication, right? Then it gives you the best options. For this patient, with this culture, with this medication he's on, this is the best 3 medications to give. And then from there, AI can also say, this is the cheapest of the medication with the most benefit.
So will AI be able to tell you the allergies?
I'm thinking, yes, of course. Why not? You can because right now, how do you know the allergies? You're going through the allergy list.
Of course. My question is, will it be able to distinguish between race or male or female? I think at certain points, that's going to be a difference.
We're getting to a point where, it's different times, right? With males wanting to be females, transgender, and we got to adjust to this. And it is going to get a little bit more difficult for that. But the same thing we do in a system. 58-year-old male comes in, whatever you document the system. So if it's a male that turned into a female and he wants to be a female, then the system, you make sure that the system knows that it's a female and that everything you do goes towards that.
Makes sense.
I really feel like AI is going to change the world, and I feel like it's going to make the medical field better. I do feel like a lot of errors and mistakes happen in the medical field just because we're so overwhelmed. We're so tired. Those doctors are working all night. They're tired. They're making their own mistakes. I do think that the computer and AI will make less mistakes because it's not tired. It doesn't have the fatigue factor. It doesn't have to use its brain when it has all the stress factors and everything that's going on in the world. I do feel like if we use it to our benefit and we make it our best friend, I feel like it's very beneficial. The
workflow will be so much smoother, right? So much smoother and easier. I agree.
I mean, look, again, I told you, it's either we adapt and use it as a friend, or it's going to take us over.
Yeah.
So we got to use it
but
to our advantage.
I think the takeover is a little far for us, at least.
That's an argument that everybody talks about. It is far, but there's a lot of things that we talked about that we didn't think was possible either.
Yeah,
even if I told you a car is going to drive itself completely, full self-drive, turn left, right, get on the highway.
Yeah, I
50 years ago, if I told you that would just...
I think you're crazy.
Absolutely crazy. It's happening, bro. Things that are happening now that are crazy, like you would never believe.
Yeah.
And AI is part of that. Now, again, there's rules, regulations. There's a lot of things that they need to clear. But any businessman would want that in their business. It's a smart thing to do. It's a good investment to invest in.
It is. But what would something like that cost? That's the question.
I don't know. That's what we're going to find out.
I don't know.
And as we do this, we're going to learn more and more about AI. And I'm sure everybody out there is interested in learning about AI.
I'd like to get our listeners' input on what they think.
Please comment below. Let us know.
And maybe kind of come up with something that you think AI would help you, not necessarily in medicine, but maybe in your business or in your field. Right?
100%. And also, guys, if you like this stuff, talking about AI, talking about medicine, and just really getting good education in medicine, make sure you follow us, subscribe to our channel, follow us TikTok, Instagram, and all the platforms. It means a lot to us. Absolutely. But again, you're also getting a lot of benefits and knowledge from this.
Yeah, I agree. And I think that this is just kind of the tip of the iceberg for AI. I think we're gonna bring this topic up a lot more in the future, because we're just gonna be getting a lot more information.
If you guys would like us to bring an expert, we can bring an expert on.
I would love that.
And then he can kind of break it down, because we don't know that much about it. Yeah, every night, I'm not gonna lie to you, I'm so interested in AI. That's all I'm watching.
Yeah.
It's just learning about AI. I want to be like, I want to catch it before. Like, I feel like there was so many things we missed on because we were just like, oh, we'll learn it later. No, you got to learn it now.
Now, 100%. So know something about it. But man, that was awesome. It was a great topic.
You guys love AI and you want to learn more about it?
Absolutely, guys. Thank you so much for watching our episode today. Please follow and subscribe, and we'll see you guys next week.
Love you,
brother. Love you too, brother. Thanks.